those programs that people have been going to, if they don't have that anymore, now they have to stay at home, and that can increase social isolation. It can increase boredom. So it's about really trying to figure out what you can do to replace the typical daily routine and what it is that you can keep and what you can continue to maintain during the day.
How should caregivers be thinking about using technology to keep these family members connected?
If your loved one is used to someone visiting, let's say every Tuesday, you can help facilitate those visits through doing FaceTime or video chat. There's some really great resources out there that can help people learn how to use those technology services. I know there's one in particular. It's called cando.com. That's a really great one. They have free lessons to teach people how to use those. But there's so many other ways that you can stay connected as well, through care packages, photographs, all different kinds of ways.
You talk about keeping that familiarity on this list, bringing outside destinations inside, surrounding someone with things that are important. How do we do that?
If your loved one is used to getting up at a certain time, having meals, and going to bed at a certain time, you want to maintain that schedule. And you can also create very visual schedules as well, that have all different kinds of visual cues through photographs, pictures, stickers, anything that'll help them cue into what the next activity is going to be for them. You really want to keep people active and motivated. So if they're used to having certain, let's say, workout routines at their day program, then you want to see if maybe you can replicate that in your living room. There's so many different ways to do that. AFA has a ton of virtual community classes on our Facebook page. And then YouTube also has a ton of channels with different kinds of therapeutic activities.
I know everyone is very different when it comes to Alzheimer's, but should caregivers be thinking about ways of explaining what's going on or avoiding that completely?
Well, I think it's always important to share with your loved one what you believe they're able to manage for themselves, because as you said, every individual is different. Everybody's at a different place in the disease as well. So for some, if you know that this is going to be too confusing, it's really just about communicating the basics on how to stay safe. And just using that as part of your daily routine, such as washing your hands and all the different kinds of things that can keep those individuals safe without having to go into the entire pandemic of what's going on. Caregivers, it's so much easier said than done, but you definitely want to be able to stay calm and stay positive, because it's amazing how people can really pick up on your body language and your attitude, and that really does affect the behaviors of the person that you're caring for. So I think it's always really important to stay in tune with yourself.
There are many different ways you can actually connect with someone at the Alzheimer's Foundation of America. For more tips on keeping a routine and taking care of yourself, you can call 866-232-8484. You can have a web chat by visiting their website, or you can send a text message to 646-586-5283, and all of that information will be in the 207 section of our website and our mobile app.